I wanted to go into medicine because I wanted to help people. I give my 100% to every patient, giving them my best in my clinical judgment, my skills, in a caring fashion, to be compassionate. I get to do a little bit of everything. I get to deliver babies, I get to do surgery. It's a primary care as well as a specialty. So I get to develop a relationship with the patients over the years. I never get tired of being in the delivery. I think the birth process is a miracle. I'm always in awe and wonder, when a baby is born.